This is a lesson to look at abnormality. This is the first lesson on the psychopathology part of the course for Paper 1, A-Level Psychology. So, we're going to consider first of all what is meant by abnormality, and is it possible to actually say what is normal and what is abnormal. So think about, do you know what mental illness means? Do you have an idea in your head about what it is? And there are some images on here and you can see could be considered to be abnormal. So what does abnormal actually mean? Therefore, this session is all going to be looking at the way in which we define abnormality. The first part of this course, this section, requires us to explore different definitions of abnormality. So by the end of this session, you should be able to describe and evaluate 4 definitions of abnormality. So if we start off by what is abnormality? First of all, I suppose we should consider what is normal. Is it possible to say what is normal? I think that would be quite difficult to ever say what's normal. So therefore we think about what would be abnormal. And once we've decided that a behaviour is abnormal, does that decision then justify us to diagnose and then go on to treat a mental illness? So as you can see, the biggest problem is deciding whether something is normal or abnormal. So we're going to have a look at a selection of pictures now and scenarios, and I want you to consider whether the behaviours are normal, abnormal, and whether somebody should be diagnosed with a psychological disorder. So should this be considered normal, abnormal? If you're going to say abnormal, be careful that it's not to do with prejudice and it's actually based on something concrete. And therefore you could argue that this is a norm, however it's not normal in all areas of society, it's perhaps quite eccentric, quite niche. Therefore, would we treat this? I'm sure that you would all agree that this is not something that we would ever consider treating. This is an example of someone living in a tribe who has a mouth plate in. This is a ceramic plate that is put to stretch the lower lip on females, and as you can see, this is very current as the person is holding a mobile phone. Again, consider whether we would think this to be normal or abnormal. Or is there a problem with this because this is not something that we understand, because it's not part of our culture, and therefore we could argue that abnormality is culturally relative. This means that we have to consider the culture in which the behaviour is observed. In this case, the behaviour would be considered normal. Here, we have somebody in a bikini in the snow. Again, we might think that this is abnormal considering the time of year. However, this would not be a behaviour that we would probably consider treating. But then when we take into consideration that this is somebody modelling for a photo shoot, once we understand the context, we can therefore understand that this is not really abnormal behaviour. So one of the things is that context matters. Polygyny is when a man has several wives. Now, we might consider this very unusual, but again, it's culturally relative. In our culture, it is not accepted and it is against the law. You cannot have a polygamous marriage. However, in other cultures, this is perfectly acceptable and therefore considered normal. Again, we need to take into consideration that polygyny is culturally relative. We would not treat this. Another example here, discussing whether this is normal or abnormal. In 1987, the Mayor of New York started a programme to help the homeless. Teams of social workers and medical experts were sent onto the streets to find the homeless and to attend to their needs. Joyce Brown was a lady living in the streets of a wealthy neighbourhood, above a heating duct near a bank and a restaurant. She smelled and frequently abused passers-by. She burned any money she was given, and she often soiled herself. Would we consider this normal or abnormal? And if we do consider it abnormal, in what way would we treat it? In what way is it abnormal? We would probably say that she's going against a lot of the norms of society, as it's not a norm to burn money. It's also not a norm to smell people. It's something that is seen as being inappropriate in society. Therefore, we could consider this abnormal. We would then go on to consider how we would treat this and what we would do. And this is essentially what this topic is about. There's another example here using the PowerPoint that you can have a read through and have a look to see whether you could consider this normal or abnormal. In some cases, people are considered gifted and talented rather than abnormal. I don't think anybody would say that Mozart was abnormal, despite the fact that he performed his own concerto at the age of 3. Homosexuality is another example of this. And this is a really good example to use and remember to have in psychology. Prior to the 1972, homosexuality was seen as being illegal, and it was viewed as being a mental illness. We can use homosexuality as an example of changing society in terms of abnormality, something that was previously viewed to be abnormal, which is no longer viewed to be abnormal at all. If you read this study of this young boy, 18-year-old, who was admitted to a ward in Chester, you can see that the way that he was treated would now be considered completely unethical and completely wrong. And therefore, this shows a change in society and a change in treatment across society also. So, as you can see from this, it's very difficult to define abnormality already. And this is something that must come across in your work. Make it clear that you can't just define abnormality in an easy way. It depends on so many things. It depends on your norms, the culture you live in, who you live in, your opinions, your religion, your beliefs. These are the 4 methods of defining abnormality that you need to be aware of for AQA psychology. Statistical deviation, deviation from social norms, failure to function adequately, and deviation from ideal mental health. You need to be able to describe these, give examples of these, and give at least 2 weaknesses of each of them. You could be asked a 16-mark question on this area. Statistical deviation probably sounds the most complicated, but is probably one of the easier ones. If we consider what is statistically strongest or most likely to happen, we are simply saying that abnormal behaviour is anything that doesn't occur often. And that would be a good way of explaining it. So therefore, it basically deviates from what you expect. You should be familiar with the use of the standard deviation and a normal distribution. So if we were to do a normal distribution of people in society, we would expect the majority of people to not have a mental illness. And therefore, we would expect the majority of people to behave in what would be considered a normal manner. So, for example, not sniffing people on the street. If we did a normal distribution on this, we would find that people who sniff each other would be towards the edges of the deviation and therefore would be statistically rare. And this, by this definition, would be considered abnormal. So as you can see here, we have a normal distribution. And you can see that in the middle, is the majority. And it says that about 68% of people fall within one standard deviation, which is the centre. You can see the arrows pointing to 68%. Now, if we look at the side here, we can see that less than 2% fall into this outer range here. People who fall into this range here and this range here would be considered statistically abnormal and would therefore deviate from what is considered to be normal. As 2% of the population have an IQ under 70, this has led in cases to a diagnosis of intellectual disability disorder, otherwise known or previously known as mental retardation. Again, we would assume that 70 and under are statistically rare and therefore could be classed as an abnormal, as the majority of people in society do have an IQ higher than this. Using your handouts and your course booklets now, you need to make sure that you are able to clearly describe this definition. You must also be able to look at strengths and weaknesses of this definition and consider how useful it is. What is it based on? Here is a possible exam question that you could be asked. What is meant by statistical deviation as a definition of abnormality? When you're answering a question like this, be sure to use an example. So the example could be the IQ example, or it could be something else that you're aware of or that we've looked at in class. So the next part is to now have a look at the strengths and weaknesses of statistical deviation. So first of all, it's useful as part of clinical diagnosis, so it is very applicable to everyday life. For example, the IQ distribution is very representative of the real population. In fact, most disorders have some sort of statistical measurement, therefore suggesting that this has a scientific basis. Again, one of the problems with this, of course, is that unusual characteristics can always be seen as being positive. And just because you have a rare characteristic, it doesn't mean that you are in some way abnormal. So we do have to be very careful with this definition. Statistical deviation, for example, is useless when the abnormality is a good thing. So if you have an IQ of 130 or above, this would be considered good. So sometimes we have to question whether the statistical deviation is a true and valid definition of abnormality, as often people fall into this but are not considered abnormal because they are considered gifted in some way. Therefore, this is not a complete explanation. Often people who are in the smaller parts of the normal distribution are labelled in some way. They're labelled as being abnormal, or they are labelled as having a low IQ and therefore not being very clever. In some cases, there's no point in diagnosing people with something such as an intellectual disability disorder, because this will stigmatise the person and will label them for life, and this is not always a good thing. This will lead to a self-fulfilling prophecy where they will eventually believe this. Labelling definitely does not benefit all individuals. Some people want a label. You are schizophrenic, you are depressed, but in lots of cases we do run the risk of the person developing a self-fulfilling prophecy. One of the main factors that I would like you to consider for this is cultural relativism. I talked about this earlier on, and this is looking at factors that are to do with culture rather than mental health. So, for example, in our culture, it is abnormal for females to have hairy armpits. However, in a lot of Scandinavian cultures, this is seen as perfectly normal. Therefore, not all infrequent behaviours are abnormal. Similarly, this neck brace is very common in certain parts of Asia. Again, it's infrequent with regards to the whole world, but it is certainly not considered abnormal in that culture. So one of the weaknesses is that it doesn't consider culture, and we have to consider cultural relativism. Here are several exam questions that you could be asked surrounding statistical deviation. Please ensure that you are able to answer all of these questions. This ends the first session on definitions of abnormality, focusing on statistical deviation.